Good afternoon. Thank you. Well, the data I will present is part of a research focused on systemic lupus in our hospital. We have been studying atherosclerosis and nutritional status in lupus patients and the association with inflammatory responses. So these are preliminary analysis of association of adipokines with clinical, laboratory, and medication and its correlation with TNF system in lupus patients. Adipokines are proteins produced mainly by the white adipose tissue. Leptin, adiponectin, and resistin are involved in the regulation of inflammatory process in lupus patients, and they may be related to the pathogenesis of the disease. Interestingly, these adipokines may interact with the TNF system and interfere with inflammatory response of lupus patients. The objectives of this study were to investigate the association of leptin, resistin, and adiponectin with clinical, laboratory, and therapeutic characteristics of lupus patients, and to investigate the correlation of adipokines and TNF-alpha and its soluble receptors, type 1 and type 2. This was a cross-sectional study carried out at Rheumatology Unit, Hospital das Clínicas of Universidade Federal de Minas Gerais, Brazil. There were 136 female patients with systemic lupus by ICR criteria. The variables studied were social demographic characteristics, clinical and laboratory findings, medications used. The disease activity index was SLEDAI 2K and cumulative damage by SLEEK ACR. Serum concentrations levels of leptin, resistin, adiponectin, TNF-alpha, and the soluble receptors type 1 and 2 were measured by high-sensitive ELISA. The statistical analysis used Mann-Whitney test, Spearman correlation, and significance level of P under 0.05. Well, the characteristics of those patients, we had a median age of 41.5 years, median age at diagnosis of 27.6 years, follow-up, a median follow-up time of almost 11 years, and the median SLEDAI score was 0, and the median SLEEK ACR score was 2. The findings, the clinical and laboratory findings were mucocutaneous findings in 19% of patients, arthritis in 7% of patients, hematologic findings in 35% of patients, mainly lymphopenia in 32% of patients, nephritis in 16% of patients. Considering medications, corticosteroids was used by 69% of patients with a median dose of 5 milligrams per day. Antimalarial was used by 65% of patients, and 50% of patients used immunosuppressors. This table showed the serum levels of adipokines and TNF system in those patients of this sample. Concerning leptin, association of leptin, there was a trend toward higher leptin levels in patients under immunosuppressive therapy as a group. But patients using azathioprine presented significantly higher levels of leptin. Considering resistin, higher levels were associated with the presence of photosensitivity, but we must emphasize that only 4 patients of this sample had the presence of photosensitivity. Considering adiponectin, higher levels of adiponectin were significantly associated with thrombocytopenia, and there was a tendency of association with lymphopenia. Nephritis, patients with nephritis had higher levels of adiponectin. We know this adipokine may present both inflammatory and anti-inflammatory effect. Levels of adiponectin were very high in 2 patients with nephrotic syndrome, although without statistical significance. And we think probably due to this small size, only 2 patients in this sample had nephrotic syndrome. Maybe we could think that may lead us to believe that in patients with nephritis, adiponectin high levels were due to its inflammatory effect. Considering the medications used, higher levels of adiponectin were associated with anti-malaria use and were correlated with corticosteroid use, corticosteroid dose. Considering the association with TNF system, adipokines and TNF system, no correlation was observed between adipokines and TNF alpha. The correlation was positive between leptin and TNF soluble receptor 2 and between resistin and both soluble receptors, type 1 and type 2. This is an interesting data, and other prospective studies are needed to help us understand these relationships. In conclusions, in this sample of lupus patients, serum concentrations of adipokines were associated with photosensitivity, was associated with resistin, azathioprine use with leptin, antimalarial use, corticosteroid dose, and nephritis were associated with adiponectin. High serum levels of leptin and resistin were associated with higher levels of TNF soluble receptors, suggesting a possible correlation between adipokines and TNF system in the pathogenesis of lupus, systemic lupus. Thank you very much.
Thank you. This paper is now open for discussion. I have a question. I was surprised by the low prevalence of nephritis in your group of patients. It was, if I remember well, only 16%. Do you have any comments on that?
Yes, that is that group of patients. You notice that they had a low disease activity, and the sample, there are patients that are invited to participate in those studies, and by chance, the people that are invited, we had only this index of frequency of nephritis.
Thank you. Yes, go.
Schofield, is it on? Hey, is it on? There, sorry. Schofield, Oklahoma, USA. How are any of these, do you know how these hormones are related to obesity or metabolic syndrome in your cohort?
Excuse me, correlated with obesity and?
Metabolic syndrome.
Oh, okay. Yeah, as I said at the beginning, those are preliminary data. And in our research, those relations or the correlations will be analyzed in sequence studies.
Yeah, I was surprised not only by the nephritis, but actually very low prevalence of photosensitivity, 4%, and the very low frequency of arthritis. So I just wonder what kind of patients you are seeing. It doesn't seem like the lupus patients that are described in the literature, that have maybe 80% have arthritis, 30% have photosensitivity, etc.
Excuse me, I didn't understand. I didn't listen very well.
Well, I'm surprised by the frequency of the clinical manifestations your patients had. In general, you're having not only low frequency of renal disease, which may be a function of the racial ethnic distribution of your patients, but also you have a very low frequency of arthritis, a very low frequency of photosensitivity, and that really surprises me tremendously because that's not what is described in most lupus papers.
Yeah, I think that's the reason is that this is a sample of patients with a low activity, disease activity. The median disease activity was 0. This was a cross-sectional study.
Then I think it's very hard to make any conclusions based on that because you really need to have the spectrum of disease activity to try to make any correlation between adipokines, disease activity, and lupus. I think that having patients with no disease activity, very minimal clinical manifestations really preclude you to really draw conclusions about the value of what you have studied. You need to have a very much larger spectrum of disease manifestations, of disease activity to really draw any conclusions.
Thank you.
Cristina, do you remember the mean dosage of corticoid that your patient population was taking? You may have presented this and I missed it.
The median?
The mean dose of corticoid.
The mean?
Yeah.
I have the median 5 milligrams.
Those are all low disease activity patients.
Yeah.
Antonio Vigna from Canada. I will actually suggest you even to check with the statistician. You have like 10 different comparisons and you're still using a 0.05 value. You actually adjust for the von Ferroni correction. You probably will find no significance at all in any of your comparisons.
Okay, thank you.
Thank you very much.